So basically, what we mean really is what it boils down to is that type 2 diabetes is a disease of carbohydrate intolerance, and that basically our bodies no longer can tolerate taking in carbohydrates in the form of sugar and starches. So you'd think then it's pretty obvious. The obvious diet that should be recommended to someone with type 2 diabetes or to prevent type 2 diabetes is a diet that is low in sugar and starches, low in carbohydrates. But what is the diet that's been recommended for the last 30 or 40 years for people with diabetes or to prevent diabetes? A high carbohydrate, low fat diet. We've been so obsessed by this sort of fat, and we'll talk about fat in a minute. We've been so obsessed about the evils of fat and how fat causes, heart disease and all that sort of stuff. We've sort of totally lost sight of the fact that it's actually carbohydrates that are the problem in diabetes. So and only now we're starting to understand that.
Is that fear of fat, is that the reason why something that seems so logical that people who, when they consume diabetes, they get dangerous levels of blood sugar? Well, it seems so obvious that we should just advise those people not to eat carbohydrates. So is the fear of fat the reason that we haven't actually made that recommendation mainstream?
I think so. It's the only explanation I can come up with. Otherwise, it's just so irrational. Otherwise, I mean, as my kids would say, duh. It's obvious that if you don't tolerate carbohydrates, then don't take carbohydrates in. And yet, this fear of fat. And tell us about the fear of fat and where that came from, Paul.
Well, I have to. If that's the reason, then that is the most baseless nonsense I've ever heard to justify, the encouraging people to continue to consume carbs. Now, the reason is, whenever we hear saturated fat, we've now got a knee-jerk reaction to say, bad, going to cause heart disease, raises cholesterol, so on and so forth. And I have to tell you that is completely baseless. When we actually look at the science, so we do these things called meta-analyses and systematic reviews. So what that means is that we have lots of these smaller individual studies that actually look at people's risk of dying of heart disease versus their intake of saturated fats. But there's so many studies that we could cherry pick one or two here or there and maybe find just through random chance, get a finding that we agree with. So instead we'd rely on something called a meta-analysis, where we get all the studies that actually looked at that, put them together and average their results. And there's been literally more than a dozen meta-analyses on whether or not saturated fats are safe that have found in favor of saturated fats. In actual fact, there's been so many meta-analyses that we now have something called an umbrella review, which is a review of all the reviews. And wouldn't you know it, that also found in favor of the consumption of saturated fats. So at the end of the day, the fear of saturated fat, and I'm talking about, you're consuming pork belly, you're having bacon, you're having egg, bacon and egg breakfast, or all of this kind of stuff.
Full fat dairy.
These are saturated fats. Saturated fats are basically what's found in animal foods. And the best level of scientific evidence we have is that saturated fat consumption is not harmful.
Yeah, and that's where we've been wrong for the last generation or two, really. And it's been a disaster. We've been obsessed with this low fat, and the problem was that they erroneously told us to take the fat out of food 40 or 50 years ago, and then the problem was that that took all the flavour out of the food. So the food industry very cleverly worked out they needed to put something back in, and what do they put back in? Sugar. So really, we've been on a low fat, high sugar diet for the last 40 or 50 years. And the results have been disastrous. We've got fatter and sicker for the last 40 or 50 years. So, that, along with obesity, levels of type 2 diabetes and a lot of other chronic diseases have just skyrocketed in that period of time. And it's directly related to what we eat. So
that's not the half of it, though, Peter. Sorry, still talking about fats.
Yeah.
Vegetable oils.
tell us about vegetable oils, or seed oils as they should be called, really, because they're not vegetable oils at all. They're seed oils, but I guess vegetable sounds healthier, so let's call it vegetable oils.
Well, let's talk about what they actually are, machine lubricants, because before they were introduced into the food supply, they were used industrially as lubricants. So I mean they're literally a waste product that they didn't really have much to do with. So then they discovered they could adulterate natural foods like butter. So they used to actually use seed oils to make fake butter and dishonest salesmen, so on and so forth. So it's got a long, rich history. But the question is why? What are vegetable oils? Why are they special? So we've been sold up the river. We've been sold a lie that consuming vegetable oils will actually make us healthier. And this, unfortunately, is not true. So I won't bore you with the details of the research, but we've got some compelling research that demonstrates that when people take saturated fat out of their diet and replace it with seed oils, that their health outcomes actually worse. And actually, I will mention one study because it was here in Sydney. So I'm in Sydney. It's called the Sydney Diet Heart Study, and it ran from about 1966 to 73 from memory. And they actually found that they took males who had heart attacks and they said, right, we're going to help you. Stop consuming saturated fat here. Have some margarine, have some vegetable oils, have all this good stuff. And they found that their death rate increased by 62%. And this is a gold standard study, what we call a randomized controlled trial, which anybody who's ever been involved in the medical profession knows that that's the gold standard of research. So we've actually got very good evidence.
Yeah, the food industry and the medical industry just managed to bury that study for a fair while, so with disastrous consequences.
Well, it's actually very interesting because it's the actual mortality data from this study was not published until about 2014, I think it was. And the only reason it was ever discovered is because the original data, that all these results that actually proved that seed oils actually kill you more, that was buried in the basement. And it was only when an intrepid researcher by the name of Christopher Ramsden actually went and found these, and it was on punch cards and magnetic tapes, and they had to reinterrogate the data. And then they found, holy moly, this really well done study has actually proven exactly what the researchers didn't want to find. And there was actually a very strong suspicion that that's the reason why the data wasn't published, because it didn't agree with the hypothesis of the authors. They wanted to find in favor of vegetable oils, so they didn't actually, unfortunately, find in favor of them, unfortunately for their perspective. So the data was buried, and it was destined to never be published.
So, Paul, let's talk about rather than talking about fats and carbohydrates and vegetables, let's talk about foods, and let's talk about where. Well, firstly, tell us about these vegetable oils. What are they? I mean, we're talking about sunflower oil, corn oil. Tell us what sort of oils.
Sunflower oil, corn oil, rice bran oil, anything that's sort of yellow and in a plastic bottle is basically a seed oil. And they come, peanut oil, canola oil, and they actually, because of their chemical nature, they have something called oxidation, which if you've ever seen a piece of metal rust, that's oxidation. And we've actually got quite a lot of evidence now that when you consume these oils, it actually it can lead to damage to the inside lining of your blood vessels. So basically, they're not a good thing. They're not as good as we used to think they were at the end of the day. And the very premise of processed foods. So I know we've talked about this concept before. So the Defeat Diabetes app, we've got a real strong focus. The underlying premise when Nicole and yourself and I were developing a lot of the recipes was just eat real food, JERF. Because if you just eat real food and you eschew processed foods, it means you already eliminate a bunch of carbohydrates and sugars, and especially a bunch of seed oils. Seed oils and carbohydrates are ubiquitous, almost ubiquitous in all the processed foods that you can purchase today. Things that are seemingly healthy, like muesli bars. I just encourage you, if you're hearing this for the first time, well, go and pick up any brand of muesli bars next time you're in the supermarket. have a look. There'll be seed oils in the ingredients. There'll be a lot of carbohydrates, and a lot of the carbohydrate will actually be what we call sucrose or table sugar as well. So these seemingly healthy foods, they just masquerade. Breakfast cereals, I mean, they really should be considered dessert. I mean, they're in no way healthy. So,
as you say, so many of the processed foods, from sauces and salad dressings and fruit yogurts and muesli bars, all things that we've always thought that were quite healthy, are full of both sugar and vegetable oils. That's not a good combination at all. So we're really so I guess what we're sort of running out of time. Gosh, we're already been going for half an hour. What we really believe, I guess, is that the program that we've developed to defeat diabetes to treat people with type 2 diabetes is actually the right sort of program to prevent type 2 diabetes and pre-diabetes. Is that right?
Well, at the end of the day, look, we've got a lot of data that following this kind of diet can actually put diabetes into remission. That means if you have diabetes and you follow a healthy eating plan, probably about half the time, half of people can actually reverse their blood results so that they no longer meet the criteria for having diabetes. Basically, they're able to, for all intents and purposes, a doctor would not be able to diagnose diabetes. You don't have diabetes. And it's only logical that the same diet that could put diabetes into remission would be the diet that would stop diabetes happening in the first place. And we know that this massive change in our diets that's happened over the last couple of generations has also coincided with a massive increase in the rate of diabetes. And a lot of people, so, we've just picked up the example of breakfast cereals and said, well, breakfast cereals are basically, sugary desserts. And a lot of people ask, well, if I don't have breakfast cereal, what on earth do I eat for breakfast? And I like to remind people that it was only 2 generations ago that we basically didn't really have breakfast cereals. For example, in Australia, a traditional diet for breakfast used to be steak and eggs. If I say to somebody now, well, steak and eggs could actually form a part of a healthy diet, they look at me like I'm crazy. That's like, oh, who on earth could ever eat steak and eggs? Well, 2 generations ago, your forebears were probably having steak and eggs. In actual fact, here's a bit of interesting history, Peter. It is a traditional NASA pre-flight meal to have steak and eggs. And that happens because of the Australian soldiers in World War II. They actually introduced this concept to the US Marines. And some of those US Marines then went back to the States and were working on the first space program. So I think it was Alan Shepard, his first meal before he went into space was steak and eggs. And I believe it's still a traditional NASA pre-flight meal today. The case in point being, we haven't always consumed things like cereals. The foodstuffs now that we consider normal is anything but.
And the problem is the food industry has produced very tasty, cheap, attractive-looking food that they market incredibly well. They spend billions of dollars marketing, and it's very seductive, particularly for children and young people. But it's been a disaster for our health. And the sooner we get back to eating the way that our grandparents used to eat, as you say, eating real food, eating meat and fish and eggs and eggs. Oh, that cholesterol! My God! Oh my God! We'll all drop dead of heart attacks. Been shown to have absolutely no effect on cardiovascular disease. Full fat dairy.
Let's address something here, though, Peter. So people hearing this will be saying, "Oh, yeah, but the science is always toing and froing." 1 month you read one article that says something, and then the other month you see an article that says something else. And I think the point is that the science has never strayed. The science has always been very clear. When we actually look at the data of what the science actually says, it says a high saturated fat, high protein, controlled carbohydrate diet, as with the Defeat Diabetes program, is very healthy. What changes is people's soapboxing. of the science, how they present the science, how they interpret the science. But the science has never changed. The science has always been there.
And the problem is that the marketing people have taken over, really. And they do a fantastic job of selling. You look at breakfast cereals. They're all brightly coloured packs with gadgets and gimmicks and so on. And little Johnny's walking along the supermarket aisle with mummy and saying, "Mummy, quick! I've got to have that. I've got to have that." I mean, it's very clever, and the way supermarkets put all their confectionery around the checkout points and all this sort of stuff.
And they gamed the system too. What about the food star system? You can have a cereal that's near 20% sugar that gets 4.5 stars, and you can have some smoked salmon that gets 1 star or 1.5 star or half of it. It's just absolutely ridiculous. I mean,
well, that's because they allowed the food industry to be part of the committee that decided it.
But the algorithm here, you want to sell food here, we'll let you design the algorithm that makes something that's been consumed for thousands of years. Salmon, we'll make that particularly unhealthy. Yes, I mean, seriously.